Good morning, everyone. On behalf of the European Institute for Innovation Through Health Data, a long name I know, I'd like to welcome you to this inaugural conference, our launch. It's a baby we've been gestating for quite a long time, and so today is for us a rather exciting, even a nervous kind of day, because today is really the launch of this exciting step. It's also the launch of something else, which is the champion program emerging from EHR4CR. And so for us today is tinged with a little bit of tension and nervousness, because we feel we're on the brink of something rather exciting. We're delighted to share it with you, and we're very grateful for our hosts inviting us to have this in Paris. Thanks all for coming. I'm going to start by giving you a short introduction to what this institute is, very briefly. But in fact, it will unfold through the day, so I don't have to give you a very long presentation for hours, because the whole day is going to really give you that hint. And then my colleague Georges Demour will also give a short introduction to the day itself, and then we'll move into our invited speakers, who I think will really give you a lot of interesting food for thought during the day. So with that, I'll begin myself and say that the reason we created this institute in the first place is because we are now at a very exciting time when it comes to the importance of health data. So starting on this slide with the research agenda, what we know is that there is a real need for improving the efficiency of clinical research. This is an expensive process, getting drugs to the market. It takes not only years but costs a lot, and is hit with all sorts of barriers and difficulties with optimizing that efficiency. We also know that clinical trial data is itself a glimpse into a narrow set of people, individuals who meet eligibility criteria. So we need to complement that kind of research with much more research that we can undertake on what's known in the industry side as real-world data, but which clinicians like myself, we just called it clinical data. To us, it's normal data. But to the pharma industry, it's real-world data, and we know that that's an important opportunity to really understand whole populations. But healthcare itself also is in need of quite serious transformation, and many of you not only know that, you're part of helping to make that transformation happen. As healthcare is more complicated, it's involving more and more settings. Care actors need to be collaborating better, to have better connected workflows and environments. That we need to adhere to clinical evidence and care pathways better. We need to engage patients much more in their own self-care and in decision-making. And we need to learn from data at population level so we can make public health decisions more accurately and so that we can plan health services better. But that magical opportunity space is hampered by a number of things that in English we call bottlenecks. They can be known as barriers, things that make it difficult to gain access to the data. And the purpose of this slide really is to say to you that if we look at these needs and benefits from health data, in fact, many of the issues and challenges are in common across these two sub-communities of health. Furthermore, taking a slide from my colleague Brendan Delaney, who I think is hiding somewhere in the audience, there's Brendan. If we take the paradigm of the learning health system, in which all of the actors involved in health are always at the edge of using the latest knowledge, the latest understanding, and are learning from their data, then we actually see that my previous slide with two communities is itself in a way flawed, because these communities need to be cooperating and using data richly together in a joint way. And that even more points to the need for us to tackle the bottlenecks together. And there are four main categories of challenge that I would like to draw your attention to, and they will feature a little bit through the day. The first one is around data security, privacy protection and ethics, which are often used as reasons why we shouldn't touch clinical data for any purposes except direct patient care. And what we need to do is to demonstrate how we can establish trustworthy ways of really reusing the data for research, and that will be a dominant theme through this morning. In the afternoon, we will also talk about the challenges of improving interoperability. Being permitted to combine lots of different data sources isn't much good if you then can't combine them. So in fact, we do need to improve the interoperability of data. A topic that we'll touch on just towards the end of the day is data quality and how we can start to incentivize improvements in the quality of the source data that we all want to then use. And also, a thread that may surface through the day, but it may not be something we have much time for today, is talking about how to sustain and scale up innovations. And this is an important area that has surfaced in work we've done with a number of projects. So in forming this institute, we consulted with a number of European projects. The icons all surfacing on this screen are examples of recent projects or current projects where we've engaged and identified the need to lift out of each project sustainable micro solutions which are solving part of those problems I've mentioned, but which are themselves a little bit isolated and not always sustained. So we want to lift all of those solutions into a place where they can be brought together and made permanently available and widely disseminated. This institute is not the only European player in town, and it's really important to give recognition of other bodies with whom we've spoken, with whom we engage, with whom we collaborate. And this institute has been deliberately positioned to be adjacent but not clashing with these other entities, so that we work synergistically and hopefully then can achieve great things together. And so we formed this European Institute for Innovation through Health Data. Slow build on this slide, okay? Which we call for short IHD, because otherwise it's too long to keep saying it. It's a not-for-profit entity that is registered in Belgium, but it's an international institution. We have already defined a business model for its sustainability through a combination of membership fees, services it will provide, and grants and other funding sources it will bid for. So we do believe we are in a great place to help catalyse and guide the future great uses of health data. And that really is our mission statement, that we want to guide, to catalyse efficient, good, trusted uses of health data for knowledge discovery and for healthcare. And that's really why we're here. What are we going to do? Some of the early things that we're going to be involved in is providing governance support to the use of the EHR for CR platform and other emergent platforms in the clinical research space that are operating at a European level. We really want to champion the use of healthcare standards, and a number of standards developing colleagues are in the audience here. We all know that there is a major drive needed to help decision makers to promote the adoption of standards and specifications and profiles in what they do. That's really important. I've alluded already to the need for us to bring clinical care and clinical research together, and we want to provide a forum and environment in which that can happen. And another really important role we want to fulfill is engaging with society. We believe that most citizens today still have a limited understanding of where science delivers great value to health and healthcare. And even when they are aware of breakthrough discoveries through the news, they almost never realize that analyzing large volumes of health data was a critical part of that success. So when they think about health data, they think about it as a thing that is dangerous, where CDs are left on trains, laptops are stolen. They think of it as only a source of risk. And we need society to really appreciate health data as a source of value to them as individuals. And so we want to work very closely with patient associations, and have already started. And in fact, a couple of our speakers today will be taking the patient perspective on board. So those are the kind of things that we'll focus on. This slide really starts to build up the more holistic picture of what we intend to accomplish in the years ahead. Best practices in information governance, solutions for analysing and integrating high-quality health data, quality assessing the systems and services so that they are themselves trusted, harmonised health information standards, and again a complementary topic, is helping to encourage the collaboration between clinical research interoperability standards and clinical care interoperability standards. And there are people in the audience here who are really with me on this, and we are planning to work together to help encourage that. How can we help to promote good intelligence derived from health data, and how can we promote sharing of comparable findings so that we can scale up? And then, very importantly, how can we demonstrate value? All of the investments in ICT that are made right across healthcare today are seen as cost centers. In other words, they're seen as a burden on the chief finance officer, something that has to be painfully endured. They are not seen as a value. People don't see the savings that ICT investments can make. We need to help to showcase how better uses of health data deliver value to the organisations that collect it, share it and use it. And that's also a mission we are on in the next year or two.